Good afternoon, everyone, and welcome. Thank you so much for joining us to hear about what is happening in Orange County with early childhood mental health consultation. My name is Cindy Jurie, and I'm the Director of Research and Special Projects at the Early Learning Coalition of Orange County. Our ELCOC works with over 400 early childhood programs throughout Orange County, serving over 23,000 young children. Our mission is to provide every child with equal access to high-quality early childhood programs by supporting those who help children grow and learn. Our vision is that every child in Orange County enters kindergarten with the foundation necessary to reach their full potential. We have a wonderful panel representing the participants who are part of this program. I'd like to introduce them to you now. First, Erika Rohlfing from KinderCare Consulting is a licensed mental health counselor whose experience in early childhood dates to her very first job as an early childhood teacher in Lake Mary and Altamont, as we were just discussing. Erika brings extensive background to her work with diverse early childhood programs in our community. We're delighted to partner with Kinder Consulting as they've worked in our community for over 20 years, supporting the early childhood mental health needs of young children and their families. Next, Ms. Joy Bouler is a child care administrator who owns 3 early childhood programs in Orange County and is the director of Great Minds Academy in Holden Heights. Joy is a graduate of our Business Institute program and is a wonderful advocate for our child care community. And then Julie Robles is an amazing teacher of 1-year-olds at Welborn Avenue Nursery and Preschool in Winter Park. Julie's participated in many of the special projects offered by the Early Learning Coalition and brings just a wealth of experience and knowledge to her work with young children. And last but not least, and hopefully she will be joining us soon, Kissha Ballard is a licensed family child care home provider who serves Central Florida representative for the Florida Family Child Care Home Association, representing our family child care home provider community. Kissha is also a graduate of our Business Institute. We'll start with a little bit of background information about how this program began. You'll then hear from each of these women about their experiences with early childhood mental health consultation. We hope to have some time for questions and a bit of discussion at the end. And if you have any questions, please put them in the chat and we'll answer them after our panelists share. So I'm going to do a quick check to see if there's anyone else in the meeting room. I need to admit I'm not seeing any. Okay, to get started. Over the past 10 years, our Early Learning Coalition has understood that kindergarten readiness is not just a matter of knowing letters and numbers. If you ask kindergarten teachers the most important skills children need to have entering kindergarten, they'll tell you that social emotional skills, the ability to play well with others, and self-regulation are every bit as important as those, maybe even more important than, the skills as far as letter recognition and phonemic awareness. Our Early Learning Coalition has worked to build a framework of supports, and now I'm going to go really audacious and try to make this share screen. Our Early Learning Coalition has worked to build a framework of supports for our early childhood community, looking at the needs of children, families, and early childhood teachers. We've been fortunate in this work to have some wonderful partners, funders, as well as collaborators, such as the City of Orlando, Orange County Government, Central Florida Foundation, Orlando Magic Youth Foundation, Florida Blue, Advent Health, UCF, and 100 Women Strong. The one program we really wanted to offer, but we didn't have the funding for, was early childhood mental health consultation, where a licensed mental health consultant works in classrooms to support early childhood teachers with the important work they do with children. Dr. Walter Gilliam's groundbreaking research in 2005 showed that preschoolers who were more likely to be suspended from school than any other age group, and that many of the children who were suspended were children of color, which makes this a profound issue of equity. His research has shown that early childhood programs who were working with a mental health consultant were much less likely to suspend or expel a child from care. And I know firsthand how important this work is because I was an early childhood mental health consultant when I was working on my doctoral program in Chicago. We know that the pandemic has unleashed a wave of stress upon our young children that we've not seen in, literally generations. Our early childhood program staff have shared many stories of young children's behavior that's significantly troubling. So when we received mental health funding through the Federal Preschool Development Grant awarded to the state of Florida in 2021, we knew we wanted to offer a pilot early childhood mental health consultation program. We started small with 10 programs. The feedback we received from participating early childhood professionals was uniformly positive, highly enthusiastic. This was, I think, the program we launched that had the most positive feedback of any that I have participated in. In late 2021, Orange County government received notice that they were awarded a SAMHSA grant that would allow expansion of this program to over 20 programs. Our panelists represent the programs that were part of this initial pilot group. We'll begin with Erika talking about her work as an early childhood mental health consultant. Then Joy will share her experiences as a director of a program working with a mental health consultant. Julie will give us a teacher's perspective of how this works with teachers in the early childhood classrooms. And then if Kissha is able to join us, she'll share the impact of her work with her consultant and how it made a real difference for her children. So with that, get started. Miss Erika, take it away.
Thank you, Cindy. Okay, well, Cindy already kind of introduced me, but my name is Erika Rohlfing. I'm a licensed clinical social worker. I've been doing community-based mental health care in our community in Orange County for the past 18 years with Kinder Consulting. For the past year, I am happy to tell you that I've been doing the early childhood mental health consulting. It's a big mouth word that I've been practicing for a day now. So I wanted to kind of go over what it is, how do we define this? What does that look like compared to other programs? So I'm going to define it a little bit for you all. I believe early childhood mental health consultation is the problem solving and capacity building interventions implemented within a collaborative relationship between the mental health consultant and one or more of the caregivers for a child. That would be typically early child care providers, family member, or I refer to it as the child's community. Early childhood mental health consultation aims to build capacity or improve the ability of staff, families, programs to prevent, identify, treat, and reduce the impact of mental health problems among children from birth to age 6 and their families, thereby lessening stress for children and their families, to stress for children and children's community members. Sometimes it's a good idea to talk about what we are not. We do not come in as therapists. We do not provide direct care for a child. We are not the expert. The experts are the people that are already within this child's community. The mental health consultant's ultimate goal is building on the child's caregivers and professionals' knowledge to promote the early development of social and emotional health. The goal is to build competence and confidence in the child's community members, i.e. the family and school personnel, thus reducing social and emotional distress for the child. So I kind of want to go over what it looks like in these different relationships as a consultant. So one of the examples would be in the relationship to the child, to the family. As a consultant, I've been involved in many parent meetings, and then as a consultant, maybe asking for a parent meeting based on what the school personnel was telling me. So in those meetings, we discuss child's particular needs or concerns, and we work together in collaboration on a goal. For example, I've been involved in parent meetings when parents have requested to discuss behavior issues that's happening for that particular child in the home, or when a parent has concern regarding their child's speech delay, or possible just a speech, they have questions about it. The consultant would work with the parent on what they already know, what's working, and discuss how to improve this regarding the child's behaviors. For child's developmental needs, for example, the consultant may work with the parent and talk about what's to expect at this age. Maybe use some guidance on expectations, or should we be or maybe we need to review on what's out there in their community to get speech therapy for the child if they feel that they need it. The second relationship of consulting is obviously the classroom. We use the lens of the consultant's role in this relationship to work with all the caregivers and the school personnel. We improve care offered to all the children by helping to identify, address attitudes, beliefs, practices, conditions that may be undermining that quality relationship between the teacher and the child. The consultant's role in the classroom is using the lens of the whole group. We may want to work on how do you talk about feelings? How do we talk about feelings in the classroom? Is there a check-in regarding the climate of the mental health in the classroom? We may want to offer support for a child in crisis or trauma-related behaviors in the classroom. For example, the consultants may encourage use of social and emotional books, address concerns regarding social skills. At several of the centers I've worked in, my big goal, my own personal big goal and working with them is talking about more about feelings, whether that's in circle time, right? Why do we check in about the weather only and not check in about how we're feeling and have discussions about that? So in one of the centers, they had developed feeling faces on the board where all the circle time is. And so what's great about that is what I would notice is that the children in that play area near the circle time and during their time of play, they would emulate the teacher pointing to the feeling faces to their friends, and the friends would be calling out those feeling faces, those feelings, I should say. So that's one of the examples. The third relationship is the pragmatic part, right? So now we're talking about directors, owners, the whole program, even policies at this point, right? So we want to work, the consultant wants to work with everyone to bridge them together. This may look like meeting with the director. The consultant may want to know how they greet the parents. It may come down to that. How do they greet their staff? Also, what would matter is just even in the consultant, do they offer trainings for self-care or mental health care for their teachers? For an example, at one of I consulted with, we discussed stress management and self-care with the director, and the director and owner took it upon themselves to create a room called the Zen Den. And what they did was put positive affirmations all around the room. They put a couch, I want to say. They did, oh gosh, I can't think of the word. They did the scents, whatever that is, the calming scents in there. I can't think of the diffusers. They put a coffee machine in there. And so my role as a consultant was really, and I still have to really prompt them, the teachers aren't used to being taken care of or offered support in that manner. So for me, it was very much like, no, you need to go take breaks. We have 10 to 15 minute breaks, whatever you need. And so we were offering that to all the teachers, and that continues to this day. So that's really one of those other pieces that I love doing this, because it's not only engaging myself in ideas, but it's also engaging the directors as a whole. So I want to finish with this. So early childhood mental health consultants really want to work indirectly by enhancing the child's community, caregivers' abilities, by offering these members positive support, promoting nurturing of the child's social and emotional development, and fostering positive relationship in the child's community. The consultant is the bridge of communication between management, teachers, and parents to support the needs of the child. So, thank you. Oh, Cindy,
Beautiful.
Oh, thanks.
It wouldn't be a Zoom meeting without Cindy trying to talk on mute. Erika, thank you. A Zen Den.
I know, I wish I could, I have a picture of it too. So I wish I would have put it up here and shared my screen to show you how amazing the Zen Den was, or
Okay.
is, I should say.
I see a field trip in my future very soon.
Yes.
Okay. Next, we'll hear from Joy Bouler, the owner and director of Great Minds Academy. And she's going to share a little bit about what her experience has been as a director in working with her mental health consultant. Ms. Joy, take it away.
Thank you. Hello, everyone. My name's Joy Bouler, as she said, and I am the director and owner at Great Minds Academy and the owner of Orlando Children's Academy and Kids Connect Preschool. I have been in direct child care for 24 years and the director and owner of facilities since 2006. Listen, I have had the privilege to work with Miss Erika at Great Minds Academy during this mental health collaboration. And I appreciate her understanding and her support so very much. So thank you so much, Miss Erika. The first highlight I'd like to give as a director, we have to hold the middle ground for our children, our parents, our staff, and licensing, DCF, and all the other components that it takes to run a successful center. But with all of that being put together on the director, we experience the pressures of feeling overwhelmed, not having the assistant or someone to talk to express what our parents are feeling, what our parents are putting on us, what the staff is putting on us, and what we're feeling from licensing. So when Miss Erika was here, she was able to hold that position for me personally and support me as the director, because everybody experienced what we went through with COVID and the shots we were taking in the army, just everything. And people getting sick, staff getting sick, children getting sick. We thought we were burnt out and overwhelmed prior to that. That just sent us feeling like we were over the edge. So much to the point that myself, I told Miss Erika, I felt like I was ready to just fold up and walk away because I didn't know what to do. I didn't know what to do with my own internal feelings. And she helped me discuss different ways to rethink what I was thinking. And I do appreciate that. My teachers, I've had two instances. One teacher that dealt with domestic violence. The consultant was able to support her and give her all of the strength, added strength she needed to come out of her situation instead of walking away from her job and walking away from her children. She was ready to walk away from everything. But the mental health consultations helped her see, just like I said, for me to rethink what she was thinking. I also had another teacher that dealt with anxiety. Her anxiety levels were so high, she couldn't interact with her parents or do the things she needed to do anytime there was a subtle change from what was her normal. Everything for her had to be straight and the way she thought it had to be seen from everybody else. But Miss Erika, again, helped with the mental health consultation for her to rethink and reevaluate how she was thinking and give another approach to it. And then lastly, she helped so much with my parents acknowledging certain behaviors, thinking about how the child was acting at school and home and pointing them in different directions to help them understand outside support was not necessarily needed, it was necessary for the health and building up for this particular child in order for him to succeed going forward. And as a last note, everything throughout this program has helped us do complete changes for a better and more positive outlook. Thank you all for the support.
Doing it again. I thank you, Joy. I know from having talked with you over the course of the last year, as you've worked with the mental health consultant, just how consistently you've sung the praises of your consultant, and what a difference it has made. Next, we have Julia Robles, who is a one-year-old teacher at Welborn Avenue Nursery. And if you know one-year-olds, there's a lot going on there, and that is not the easiest of jobs. And Miss Julia is going to share with us how she found working with her mental health consultant. Ms. Julie?
Yes, absolutely. So thank you everyone for coming in. As Miss Cindy said, I am in the 1-year-old class, and I have currently 13 1-year-olds, 3 teachers in there, and I have 1-year-olds from sometimes from the moment I walk in and clock in, and sometimes they clock in with me, and until I clock out. So we always have children. Like, our children are always there. And that's our priority, is to take care of them, make sure they are safe, and so they are happy. So with the most important thing to me with our mental health care coordinator is just the fact that she was there. She's there developing relationships with our students, where my own students have relationships with her. They see her, they get excited, they get happy because she's so great. And, so many times as teachers, we're in the moment where the students are doing their thing, and we're thinking about the next step and making sure everyone is safe. And we might see a behavior that's new. We might see a behavior that's concerning, and we may not be able to address it in that moment. We address it with the child, but being able to say, okay, what does this behavior mean? Let me document it later. And, we forget, we're human. But having our mental health coordinator there, she saw it. She would sometimes be able to address it right there, give us tips on how to address the behavior. And again, this was a person who was willing to roll up their sleeves on spaghetti day and help feed the kids, help the kids, help us make spaghetti day perhaps a little bit easier, willing to participate in our art project. So again, just being there and being able to discuss things in the moment. And then take it to where it needed to be. Either say, hey, let's have that discussion later, or let's bring it to the director later. And by being in there and being able to see that, I think a lot of times too, it added credibility to some of our concerns as teachers. We may bring something up to our directors, and again, they have a lot on their plate. So now we have a second person saying, this is something that we should be addressing because this is somebody else seeing it. One of the most important thing our coordinator taught me is that, and it's so simple. It's find the one thing you can control. What can you control in this moment? Is it your emotions? Is it the action that you're doing? If it's only one thing, just do that. And by finding what I could control means that these fun moments with my toddlers, my 1-year-olds, I can enjoy it now, because if things go a little crazy, that's okay. I have them in my classroom, and I'm enjoying the moments more. I'm enjoying my work with them because I know I have that support in that background. So I think just, again, having her in there with us in the classroom, as someone we've grown to trust, to rely on, someone we know we can depend on. It's something that I've never experienced. It's something that, it took really developing that relationship. And it's just like the kids are, I'm excited every time we see our mental health consultant come in, because, it's just going to be someone someone that's there for us as well as the children. So thank you.
Thank you, Julie. And I remember when we did our focus group over last summer, when we first started the mental health consultation, that was something that a number of the teachers talked about was, they're used to having people coming into their classrooms and kind of, like looking at what's not maybe as it should be. And with the mental health consultancy, it was just kind of like a whole new world of, this person is coming in to help support me to be the best I can be as an early childhood teacher, and how powerful that was for them to feel safe and, secure in, admitting that, okay, this child is pushing all my buttons and I just don't know what to do. It speaks volumes to the talent of the early childhood mental health consultants we have working with us in our programs, that really they were able to, just make these connections and build the trust with our teachers and our directors and our family child care providers, because we did include several family child care providers as part of this, because we certainly know that our family child care providers are working most of the time. They're flying solo, so it's them and up to, I think, 11 or 12 children. of assorted ages, and that can be especially, challenging. And I'm disappointed that Kissha was not able to join us today because she has a very powerful story, and I'm going to try and tell it, but it's not the same. I will tell you, she is much better at telling this, but she has been she's a very experienced family childcare provider, has mixed age groups, a little bit younger group. She had a child come into her program, I believe it was last year, and preschooler who had been kicked out of other childcare programs. And she was willing to take him in because she's a committed early childhood professional. But he came in and, it was a challenge for her. The behavior was something else. And she was really, trying, but it was one of those where she really was about at the end of her rope and really considering having to be like the next center or next, childcare provider who said, sorry, this is not working. He needs to go somewhere else, when she began working with her mental health consultant. And what she said was it was just a game changer. Her mental health consultant was able to show her ways of, like finding the things that this child enjoyed and using those, items to kind of work with him so that his behavior changed. Her approach to his behavior changed, but his behavior changed too. And it made a profound difference. And it also made a profound difference for the child's mother, who you can imagine after her child had been, asked to leave several childcare programs, was probably very close to the end of her rope as well. Kissha has said that it really, the mother said that working with the mental health consultant, made a powerful difference at home as well. And that is exactly what we're looking for with this, is that, we support teachers, but it's also supporting children, because it really significantly reduces the likelihood that a child will be asked to leave or, kicked out of a childcare program. We know when children are kicked out of childcare repeatedly, that has a consequence on their behavior and their ability to engage and trust in others. So this is something that the ability to provide these kind of supports to our early childhood workforce, especially at a time when we're seeing such a dramatic shortage of early childhood teachers in our community, really is, it's a real teacher support, a true lifesaver, as it were. So since Kissha has not joined us, we're a few minutes short, but that's good because it gives us opportunity to have more of conversation. And if folks have questions or comments, you can unmute yourself, I believe. Okay, Darla has a question. Does the consultant work directly with the parent at any point? Erika and
I'll answer it.
team,
Hi,
you can
Darla.
answer.
Yep. Hi, Darla. Yes, we absolutely do have, again, it's within the framework of usually the preschool. So if it was like Joy and I, when we would work together, it would be the teacher maybe saying something about the child's behavior or something happening for the child. I can give you different examples too, but this one in particular, Joy might remember. I think the little kiddo still goes there, but I know he does, Joy.
That's a good thing.
He had a lot of behaviors and developmentally delayed on multiple levels. And so, I went with the teacher. I just asked her, what did she need support in? Getting her to the place of maybe saying something more to Joy about how she's struggling. I mean, we were struggling in the classroom with this kiddo. And so I still remember seeing Joy in the kitchen going, Joy, we need to do something. We've got to have a meeting. You've got to and Joy, actually, what's great about it as a consultant, when I was working as a consultant with Joy, we called the parents. Joy set up the meeting, and I just came when Joy told me to, or when I could. And so we came to the meeting, and those parents, Joy was worried that they were not going to be accepting. And we really worked through, it's like therapy a little bit in terms of getting them to the point of really understanding what's happening in that classroom. And they were able to move on and get speech for this child. I couldn't believe it. They were amazing. They had speech, they got occupational therapy, all the concerns that Joy and I both had, they were able to meet with. So yes, that's one way to have a meeting with a parent. The other way is when the parent just asks, or the preschool lets them know we have a mental health consultant working with everyone. And sometimes they just want to have a meeting to talk about their child. And that's okay too. It just all depends. So I hope
Joy
that
or Julie, do you have anything that you want to, just as far as how the consultant might have worked with parents in your program?
I know our consultant set up, not only does she make a point to introduce herself to the parents as they dropped off the kids, again, developing those relationships, but she has tried to set up meetings for the parents about self-care, about caring for the kids. So yeah, I definitely know of meetings that they've had with parents concerning behaviors that we've seen. So yeah, they definitely usually set up, like Miss Erika said, through the framework of the school with the director in that sense.
Joy, anything you want to add?
My current consultant has changed from Erika. I have Miss Nicole now, and she's wonderful as well. And we had a very unique circumstance come up with a parent that needed direction. It was way out of my ballpark, but this particular parent, they experienced a home invasion. And it was the child that was under the bathroom sink calling 911 and watching everything. Well, she was hearing everything unfold in the living room with the intruder. But now you have a child that has been traumatized, and that's not a trauma that I know how to deal with. But Miss Nicole was able to work with the child every day she comes in, and also was able to give the mom phone numbers and resources and point her in the direction she needed to go in for herself, for her family, and for the child. And it has turned into, just a beautiful, harmonious working relationship with the mom coming in, looking for Miss Nicole on Tuesdays and Thursday to give her a report, feedback, and we've had no blips with the child, walking out and talking and expressing herself how she needs to in order to process what she had to go through. So I don't know what we would have done if Nicole hadn't been there. It's just like, whew.
It's interesting you mentioned that, Joy, because we've had, when I say this year has been a challenge, that's an understatement, actually. We've had several incidents that have gone on in our early childhood programs recently at the centers where the mental health consultants have worked, and having a mental health consultant who is already boots on the ground in the center, has the relationships established with the teachers and some of the families, has been an enormous benefit, because it means that it's not like you're bringing a new face into, those relationships of trust are already established. And it's been a profound, really has made a difference in offering help and support to families when really bad things happen.
Yeah. Mm-hmm.
Yes. Okay. Nancy asked a question as far as many of her students who are in the UCF Early Childhood Program are preschool teachers and would benefit from these interventions. How should I direct them to access these services? Okay. This is the, the good and then, challenging. The good is that we have these services, but it's very much a pilot initiative right now. The Early Learning Coalition, we started with 10 programs. The SAMHSA grant allowed us to expand to 20 programs, but that's like really capacity right now. However, this is Cindy jumping on the advocacy soapbox for just a minute. Orange County's Youth Mental Health Commission presented they did a study and did a report to the Board of County Commissioners back in February, I believe it was, in terms of making recommendations as far as what was needed in our community as far as supporting youth mental health. And the recommendations were for altogether, the different programs that they recommended were like $49 million worth in different supports and services. But the really important one, and this is one we all need to keep on our radars if we think this is a great idea, is that they recommended $27 million for expansion of early childhood mental health services. That would be a profound expansion of like services to allow many, many more programs to participate. So, you know, with budgets and, you know, everything that's going on with county government right now, we don't know, but I'm keeping my fingers crossed that this will actually come into being. And, you know, hopefully there will be some strong advocacy on the part of our early childhood community for this service, because we know that if you can get in early with young children with positive mental health and social emotional development, the impact can be lifelong. So, you know, that's you know, kind of where we are right now. It's like we really don't have capacity to expand right now, but we're keeping our fingers crossed and, you know, hoping that that will change in the not so distant future. Okay. We had another question: is Kinder Consultants the only mental health partners on this initiative? And yes, that is. Because of the amount of money that was involved with this initiative, we had to put out for an RFP. And when we did so, Kinder Consultant was the only mental health service provider who responded to the RFP. They have a longstanding history in our community, have been very engaged in the early childhood mental health space for, you know, quite some time. We did have one vendor who asked us if they could do this via like telehealth. And the answer to that was no, because it really is something that it's important for the, when you hear Joy, when you hear Julie talk about what's going on with the mental health consultants and the teachers and the directors, it's because they're in the classroom, they're helping out with spaghetti day, they're seeing, you know, parents and, you know, making those relationships and connections. And at this particular moment in time, we really didn't think that was something that was a telehealth kind of option. So, you know, that was my strong preference. But, you know, building relationships is really at the heart of this work. And I think we have been really, really very fortunate with the wonderful mental health consultants we've been working with Kinder Consultant. The other thing that we have done as part of this initiative is in support of, because our coalition has a real commitment to equity, is we are working to support having mental health consultants who may not have the early childhood mental health experience to work as mentees as a part of this, so we can develop and diversify our early childhood mental health workforce, because it's really important as our community's diversity kind of changes, that we have a early childhood mental health workforce that reflects our community and all its wonderful elements. So this is something that we've been really happy with being able to support with Kinder Consulting as well. Other questions or just thoughts, comments, observations? You can unmute yourself, I think. I think I have.
I'm just so grateful that for this initiative, Cindy, and I just absolutely love it, because I think people kind of fail to realize is that, especially at least in the early childhood one, it's just like my, you know, trauma-informed care, special education knowledge is very surface level. You know, that you really don't go into too much depth unless you specialize in special education, at least at the, you know, the university level. So, you know, sometimes I think people expected more from me in the classroom because I had the, you know, the bachelor's, but I'm just like, hey, no, this was surface level, you know, understanding as far as this. I can see the signs, but where to go from there, I have no idea. I need additional help. And to have somebody to give you that additional help, I mean, I would imagine feeling very happy and less stressed knowing I had that person, because there was a lot of times where, I just felt like, I was just like, I don't know how to help this child because I just don't, I know that this classroom is not set up to help meet their needs, and whether it's a sensory thing or just, it's too much, overload, stimuli, whatever the case may be. And it's just like, I don't know how to change it so that I don't, change everything, because there's kids who do like this, and you want to be sensitive and do that, you want to be inclusive, you want to be all inclusive in your classroom. And I just know that there's a lot of teacher burnout and there's a lot of high turnover because they don't feel that support and they don't have that support. So I loved this. I love the fact that people are now starting to see like there is a need and there is so much benefit to having things like this, starting with the itty bitties,
Yes.
And I thank you for that work and I thank you for that advocacy. And yes, fingers crossed that it just gets stronger.
We can hope, because honestly, we know from what our teachers told us that having, sometimes it's, as Julie and Joy kind of indicated, it's having somebody who's coming in from the outside who's looking at it, and it's, what teacher says, I'm not sure about this. Having that, like outside perspective, who's not coming in a judging way, but in a how can I be of assistance way, can really make a difference. And it's especially important right now because we know with the pandemic stress that has gone on, we're seeing with our kindergarten readiness rates this year in our communities that are overburdened and under-resourced, sizable number of children enter kindergarten not ready, because let's face it, the last 2 years have not been have just been unpleasant in so many ways for so many families. And this is the first wave of what I'm unfortunately think will be like continuing for several years to come. So it's really important that teachers, get that support, because otherwise, if a child is having behaviors and they go into a director and say, it's the child or it's me, directors are, that child is getting a fast pass to the door, and that's not good for our little ones. That does not help them in any way, shape, or form. So, Karen, I see you have your hand up. Comment or question?
You kind of mentioned what I was going to say, that I think sometimes teachers are too close to the situation and their emotions are too heavily involved. And so when you have that person that comes in and has a totally different perspective of what's going on, it can really help, because we have to manage our own emotional mayhem before we can help the emotional mayhem that's going on in the classroom. And another person's perspective. The thing that needs to happen is that the teachers need to trust what that person is saying, because they can be like, oh, they just write you off. When somebody from the outside says, well, I think this is what's going on, you're like, oh no, he's just being stubborn, or whatever it is. You have to have a buy-in to and trust with the person who's supporting. And I think, I don't know what causes that, it has to be a really good person to come in. Erika, great job, by the way.
Karen, I will say that first, and you can ask Joy, Karen, I will say that part of our instruction going in was we are only there. I felt, Joy knows this, like I literally didn't make any moves per se for some time. I was literally there praising by them. I literally was watching and praising and asking questions. And I wanted to be almost like, it was so hard because I just sit on my hands because again, I'm a helper. And so you understand that, Karen. So that's what happened. I really was more of an observer in the beginning and building that rapport. So they did feel safe because again, Cindy describes how many people come in those classrooms that are, testing them, watching them. And it took probably, I would say, and Joy, you can correct me, probably 3 months for people to talk to me as if I wasn't a threat. or
Right.
talk to me outside of just work, because that's really
Right.
where we're here for the teachers, to really talk about what's happening for them. Joy would go around and introduce me and like, she's here for you. And they did not believe that.
Nope.
They
Didn't
would not
believe it.
take Joy on that
Nope.
offer, by the way.
Nope.
There was
Nope. I
I
had to
know.
have so
Yeah.
many
Mhm.
sidebar conversations
Yes.
with each one of my teachers.
Yes.
I'm like, you gotta loosen up. She
Mhm.
is friend. She is not
Mhm.
enemy. And believe me, everything I would tell the teachers, you're sharing with her. She's not sharing yours with me. I have my
Mhm.
own stuff. I would
Mhm.
talk about, I have my own stuff
Mhm.
that I'm dumping in her lap and she's assisting me.
Mhm.
She, and it took 3 months, but
Yeah.
Mhm.
they
And I know,
got to the point
for
they trusted
us,
her.
yeah, yeah. For us, it almost in the early days, I can think of a few times where we had been addressing or trying to address either a change in the classroom or a change in behavior, and it didn't necessarily happen. Whether it was just on the list of things to do, but suddenly when our mental health consultant, we expressed our concerns to her, the next day it was changed. And it was like, oh wait, like she is on our side and she's getting things done. So again, it what I said earlier, it added credibility to our concerns. And then it began, it wasn't just us maybe feeling burnt out and complaining about this kid. This was a real concern. So she did take the time again to build that trust, and we do realize she's there for us. She's there. She's one of us. I consider Rhonda one of us. She has her little key card to get in the door, and we just walks in and sits down. So
Joy gave me my key card too. I miss that. I miss my key card.
yeah.
Yes.
But that approach, as far as the consultative approach, where it's not I'm the expert coming in and you here are the recipient of my, like wisdom, but really that, that relationship building that takes place, as Erika said, it takes a while. I remember when I was doing this in Chicago, and started out with my very experienced, supervisor I was working with, and I was it took a little bit to sort of like, she's like, you're making the relationship happen. This is where relationship building. This is going to take a while. And it was like, oh, okay. And you just can be there in the moment then with the teachers as far as what they're experiencing and listening to them and really hearing, like what's okay and where the challenges are. And that's part of, I think, the magic that, makes this work so well. Other questions or comments or thoughts as far as one of the things that I know when we talked with the teachers in our focus group this summer that several of the teachers said is we didn't know exactly what this was when, the consultants started to come in. And so there was a little bit of skepticism as far as like, okay, who is this coming in my classroom now? So it really was the burden was on the mental health consultants to, build those relationships. And it's one of those where I'm still thinking about how can you better explain to folks, as we hopefully will get additional funding and be able to do more with this, how to help teachers understand, this is where, this is really a support for you.
Yeah, just making it a priority. And I think that's the problem as a society as a whole is that we don't value mental health and how that just like with anything else, you may need support in it. And that doesn't mean you're crazy or need to go to the nut house. It's just that, sometimes some people, they work better when they have, or they work out better more when they have a trainer because it's just someone there, and that's your physical health. And, your mental health is just as important and honestly, probably even more important because, without your brain, you can't do anything else. And if you are not in that mind frame of, okay, I'm not stressed. I'm not in survival mode. I can do this. I can have that. And I just, like I said, I love that again, as a society as a whole, we seem to finally are starting to see the importance of it and how some people need support and how, again, like something's happened in me, but I don't know what I need someone to talk to.
And that I think out of the pandemic is really, the just how interconnected we are and how that support and is essential to positive mental health is really, become very evident. And it's frankly, it's a good thing that that's the case, because when I say we've got some really serious issues coming up amongst our little guys under 5, I am not joking. It just, some of the things that folks have shared with me, I'm still kind of like just blown away by.
Yes, I just want to say I really love how Joy said, was able to acknowledge this is not a situation that I can deal with. And I have this person here to support me. I think letting teacher understand that you don't have to know it all. You don't have to. That's why we need each other. We can't be everything in at once, So we need each other. But I really love how there's not this judgment. It's not a judgmental thing. You're not doing this right. You're doing this wrong. Or judgment or punishment, but it's helping, it's building. I have been learning quite a lot through this conference, and it's just never crossed my mind that daycares or childcare in low-income communities are dealing with a different set of issues compared to other childcare in communities that are not low-income. And so I think acknowledging that make me understand now better why we do need mental health counselors, assistants, and childcare, especially in low-income communities.
Mm-hmm. The impact of the pandemic has really been, it's been equal opportunity, because I hear things from some of our higher end programs about children coming into VPK at 4 years of age, not potty trained and still, carrying like a bottle of milk in with them. But I think it's been especially challenging with our communities where parents had economic issues because their hours were reduced or they lost their jobs. The housing instability that we have going on in our community right now because of, like rents increasing, neighborhoods changing. So there's a whole lot on the outside world that's having impact on families, and that impact on families is definitely being felt by children. There's a mindset that's kind of like, oh, well, children don't understand, but those of us who work with children know that they read the situation even from a very, very young age. And, the behavior we see in the classroom oftentimes is a result of, they're kind of picking up on the stress cues of the adults in their environment. So, yes.
Yeah. And it's like, just because they may not understand doesn't mean they're not affected,
Exactly. Yes, exactly.
Yeah.
And children communicate through connection and behavior. So that's what's happening. For example, I just wanted to bring this up because I'd forgotten to talk about this, but we had 2 years. Some of them had a whole year where they weren't even going to the preschool, or they were, and then they were out again. So when the time came for that towards the end of, I want to say, gosh, everything's mixed together. You guys, I have that COVID brain that I'm like, what year was it? Anyway, so when I started was 2021 in the summertime, right?
Yes.
April. In that August, when they were going to change classrooms. When I say it was an upheaval for these children that had gone through COVID in the same school, when I say just that change in classroom, we saw such dysregulation. And you see that obviously when they transition to a new classroom, you see the hesitancy, you see maybe more separation anxiety. When I say that it was like 80% of the class, and it wasn't even just that, it was that it lasted not just a month, like a normal separation adjustment, or maybe 3 months. We were seeing it on the long end of 8 months. 8 months of dysregulated children in a classroom, multiple. And I just remember talking with the director going, this has to be a direct result of COVID and all these
Mhm.
changes that have manifested in these children's lives. Again, like we talked about, we're just looking on a preschool level, but imagine what they've gone through. Parents have lost jobs. They've had to move in with family members. They've had to move out of their housing. They've gone homeless for a while in there. They haven't been to school at all. There's so many aspects that it's just so mind-boggling. But when that happened, I will say I won't forget. It's like that time where I'm like, I'll never forget this year. I'll never forget that transition and how difficult it was for all
Yeah.
these babies.
Fear
Yeah.
can be really paralyzing.
Yes.
And I think they witness their parents sometimes being paralyzed by fear, and then where do you go when your safe person is disabled?
Exactly. That's exactly it. Well, Kissha has been able to join us. Kissha, welcome. So what I'm going to do, I tried to tell your story a little bit, but I don't tell it as well as you do. So if you would, we can close out by Kissha telling us about how her early childhood mental health consultant helped her with one particular child, and then we will close out. It's like
yes,
ending
hello
on a fest.
everyone. Hi everyone. I just like to recognize how mental health has helped me as well as my students. I have one little boy that was is considered special needs, and how when he first would come, I had to bribe him to get in the door, come walk up to the door and everything. But after a couple days or so, I'll say within 3 days, he started walking in. We had his parents. What happened is he got kicked out of school. And so she brought him to me. And it was mostly, he was a special needed child, needed the attention that he needed. And what helped me to work with him was the help that I had from the specialists that were coming. And they gave me information on how to handle situations, what they were called. They could identify what it was. And after that, now he is coming in with a smile. He goes above and beyond what is expected of him. He just unbelievable. I just really see how he has improved so much with just everything. I mean, his mother, she was almost in tears because she thought there was no hope pretty much for him. I have another parent, and her child is special needs, and she was going to a center, and I'm a family home, and the child was crying. She said every day she was crying, and she's been going there from a baby. And she came here, and all I did was just show her love, redirect her. My specialists that work with me identified what was going on with her, what it was called, how to handle it. It gave me relief because, it can be stressful. I'm by myself, having all ages, mixed ages of children, and just having someone there to help me and show me and guide me. Now the specialists look at me and say, Kissha, can you believe this? And it is such a load off. That's with the children being special needs and things like that, how she's helped me with that. Another situation that has been helpful with her coming in, and it is actually, I had to do a project with the kids. And I had the kids, I was just so worked up till I've never done this before. I never even felt this way. And my heart was just beating. I had to go and walk away, take a break. But had she not been there, I would have constantly been in that stress mode all the way till they laid down. So having mental health specialists with us is tremendous help for us, especially me with being in a family home with mixed ages. I couldn't have done it without them. And I hope that that's something that we can continue having that service, because it is greatly needed.
Kissha, thank you so much for being like, just making that is just like the perfect way to end this with your experience with this. Thank you all for participating in our session. And, please, consider if there's a way for you to advocate for these kind of programs for our little ones. They make a huge difference and, have, I think, a real tremendous impact on our future. Have a wonderful afternoon and a great next session. Take care.
Thank you.
And thank you again
Thank
to
you.
our ladies who came in to share their expertise and knowledge and how this works.
Thank you to the panel. Very informative.
Thank you.
Thank you.
Thank you.
Thank
Have
you.
a great day.
Yep.
Take care,
All right.
everyone.
Bye-bye.
Bye-bye.
So much.